What is imagery rehearsal therapy? Great question. Let's talk about it. Hey, I'm Dr. McCleary, and in this video, I want to talk about IRT, or imagery rehearsal therapy, what it is, and why it may be able to help you with your nightmares. Most people have experienced having a nightmare, a night terror, a bad dream in their lifetime. But there's some individuals that struggle with recurring, frequent, intense nightmares to the point where they can't sleep or they don't even want to go to sleep. Nightmares, for lack of words, suck. And they suck for multiple reasons. One, they're often terrifying. People often wake up and they may not know where they are. They might be hypervigilant when they wake up. They might be sweating. They might be kicking in their sleep. Okay. So the intensity of the nightmare sucks. You know what also sucks? Not being able to sleep. I tell people all the time, if you want to have a bad day, don't go to sleep tonight. See how you feel tomorrow. Sleep is incredibly important to our health. And if we're having nightmares on a consistent basis, most likely we're not sleeping very well. Maybe this is because I'm an 80s baby, but I think one of the scariest movies out there is Nightmare on Elm Street. Freddy Krueger. You know why? Because literally the guy gets at you when you go to sleep. He gets at you in your nightmares. Terrifying. Nightmares for a lot of people, even though Freddy Krueger is probably not in them, make people not want to go to sleep, which obviously reduces your sleep very quickly. And the less sleep that you have, generally, the worse that you're going to feel the next day. And your body may even start to shut down. You might get irritable during the day. You might find it hard to concentrate. And that's why nightmares are a symptom that can be terribly debilitating. Nightmares are a common symptom with a lot of different mental health disorders. But for individuals that have PTSD or post-traumatic stress disorder, about 70% of those individuals struggle with nightmares. Now, about 30% of people that suffer with major depressive disorder also struggle with nightmares. And about 30% of people that struggle with personality disorders also struggle with nightmares. I said that nightmares are a tricky symptom. And one of the reasons that it's a tricky symptom is you can go through an entire PTSD protocol and do well. A lot of those symptoms come down. And somehow you still have those trauma-related nightmares. One of the reasons for this is in most evidence-based trauma-focused treatments, nightmares are not directly addressed. But the treatment that I'm about to talk about addresses nightmares head on. Imagery rehearsal therapy, or IRT, is an evidence-based treatment that directly addresses nightmares. IRT is based on the idea that the experiences that happen to us during the day often show up in our dreams. There are multiple IRT protocols out there, but most of them comprise of the following components. 1, education on what nightmares are. 2, selecting a nightmare to work on. This may be the most frequent nightmare. It might be the most intense. It might be the least intense. Or It might be the one that's recurring for you, happening over and over again. Protocols not always, but often involve some exposure to the nightmare. So talking about the nightmare, stating what you remember about the nightmare. And the last piece, and arguably the most important piece, is rescripting the nightmare. When we talk about rescripting the nightmare, really what we're talking about is changing the nightmare during the day to a safer experience, to a more happy experience, to a more calming or pleasant dream. Maybe even adding some humor in there. I can recall working with a veteran one time, and we were rescripting a nightmare in which there were a lot of mortar attacks. And this individual had to slide into a bunker. Okay. This nightmare kept happening over and over again. And part of the rescripting ended up being he still slid into the bunker, but the bunker was somehow filled with butt-naked women. Okay. My first response was, that is totally inappropriate and not something that we should probably do. However, guess what? We went with it. And by rescripting the dream this way, the dreams for this individual actually got less frequent and less intense. If you're getting value out of this video, go ahead and hit that like button. Rescripting a dream will look different for everyone. For some people, it might be putting in reminders that it's a dream. For some, it may be putting in reminders of safety or a sense of control. But it's not always happy. And we're not always trying to just totally change the content of the dream. I want to give you guys another 80s reference. So what we're really trying to do is change a dream that involves Freddy Krueger to a dream that involves Edward Scissorhands. If you've never seen Edward Scissorhands, see it. It's a classic. The last step in IRT is rehearsing the script multiple times during the day. Going back to the idea that what we do during the day actually shows up in our dreams. And this is how IRT works. By rescripting the nightmare, you actually change the nightmare. And as a result, a lot of people end up having less intense nightmares, less frequent nightmares, and some people even are able to eliminate their trauma-related nightmares. So that, in a nutshell, is IRT. If this video was helpful for you, please like it or subscribe to my channel if you want to learn more about mental health. Or if you have any questions, go ahead and put them down in the comments. But more important than all that, if this video was helpful for you, that means that it could probably be helpful for another veteran. So I ask that you share it with them. Because at the end of the day, that's really what all this is about. One veteran trying to help another.